Hello, this is Dr. Frank Barone at Evolve Medical Aesthetics Plastic Surgery, and I'd like to talk a little bit about this month of May, in that it's Skin Cancer Awareness Month, and with over 6 million new skin cancers diagnosed in the United States estimated for this year, and one person dying every 52 minutes from the most deadly form of skin cancer, melanoma. I think it's of critical importance that we have more public awareness about this increasing problem. There are more skin cancers than all other cancers combined, and the incidence is going up rather significantly. The reason for that is somewhat complicated. Number one, a lot of people feel that if they put sunscreen on, they're preventing skin cancer. And yes, that's true for future skin cancers, but it doesn't protect you against all the sunburns you had before that, many years ago. And a sunburn you had in your teenage years may cause a cancer in your 30s or 40s. The damage accrues over time, so previous sunburns can cause cancer, so the sunscreen won't help you from those previous sun exposures. The other thing is that studies have shown that only 25% of over-the-counter sunscreens are shown to be as effective as they're labeled. That's a little frightening because people are using more sunscreens, but we're seeing more skin cancers. There's also research evidence that some sunscreens, a lot of them actually, are breaking down, ironically enough, in sunlight and not affording you the protection that you're putting them on for. So I think it's very important that this be talked about and more education about this problem. So in respect for our patients with skin cancer, and for this month of May, Skin Cancer Awareness Month, I'm going to be doing a peel, a home peel, because the skin cancer cells that you've had from previous sunburns or sun exposure are embedded in the skin, and a sunscreen won't help against that risk. So consequently, we're going to be doing a home stimulation peel with Zeo's Advanced Radical Night Repair product. This is a microencapsulated retinol, which allows the retinol to penetrate much more effectively than typical retinol or retin-A's. So the purpose of this is two things. One is to exfoliate and get rid of all those surface cells that have cancer risk and from sun exposure, but also to stimulate the growth of new cells to replace them. So lose the old cells that have cancer and are damaged, grow new cells that are not. And it's interesting because this product is unique in its with its microencapsulation oleosomes, which are little carriers that allow it to penetrate into the skin. This is a diagram of the skin. The product will penetrate very deeply and will even stimulate the deeper layers of the skin, which is critically important because it's not just enough to peel, you also have to stimulate the deeper layers to replace those cells. So I'll be doing this for 5 days, morning and night, and we'll have a report back to you after my face is a bit more red and peeling. But we look at peeling as a healthy thing because you're losing old cancer-prone cells, and the redness is a sign of blood flow. So I'll be back to you with a red face in just a few days. We'll start the peel on Friday the 13th. Morning and night for 5 straight days, and I'll see you then for our first day. Thank you.